and the burnout that we would also like you to share, both your personal and your professional experiences. And I will turn it over to Hadija Steen Mills to be the first person to comment in these questions.
Cool. Peace, y'all. How's it going? Happy evening. Happy for those in the Twin Cities. Windy evening. You may see my kitten joining us. Her name is Gertrude, so don't mind her. And you also may see me sewing. That's something that brings me rest and joy. And so just shouting that out. I also wanted to bring some folks who are not on the panel into our panel discussion. And I'm actually going to start with a reading from Rest is Resistance because, you know, we got to get there. We didn't have a meditation. So let's bring in some voices. So we must uncover, simplify, and let go of our addiction to busyness. Let our rest become resurrection. Let the veils be lifted so we can feel, see, taste, and smell the power of our rested selves. May we realize a full mental shift must be made to reimagine and reclaim rest as holy. May we be excited by the impossible and move through any cynicism or hopelessness to emerge on the other side steady with love, persistence, and hope. Rest can save, sustain, and prop us up when we feel weak and our backs are against the wall. Our greatest hope to thrive and disrupt is to rest deeply and intentionally. The rest is the work. It is how the portal for liberation and a reckoning will emerge and remain open. May the portal of rest be our refuge. May we go there often. This was something that really called to me in terms of the question that was initially offered around how might we define the problem of rest. And when I read this question at first, I was like, problem, rest is a problem? Wait, hold on. And it really stuck me. When we're thinking about an anti-rest system, we're really thinking about a system rooted in racial capitalism that really is designed to exploit and disempower our worth and our value. And so when we think about the problem of an anti-rest system, we're thinking about the problem of capitalism. And when we think about that problem of an anti-rest system and the problem of health and healing, we are at odds. Health and healing and exploitation should not be something that go in hand in hand, and yet they do. And so that is the problem, is that we're at this weird paradox, this weird oxymoron of system of healing and a system of exploitation. That's the problem as I see it in a really, really high level, is the context of health and domination. And when we think about how we got here, there's a huge lineage in terms of how that exploitation and that domination has showed up within the health and healing landscape. I want to bring in some folks who've done some amazing work. The Healing Histories Project has a beautiful timeline that really portrays the pain and harm that's been done by healthcare systems throughout time, and how that's looked not only in public health, but within direct service, within trials, within clinical trials as well. And when we think about how we get there, I would encourage you to pick a date that's really important to you and see, how did we get here in terms of, thank you for whoever just got that in, how did we get here in terms of how health and exploitation became to be hand in hand. I'm here representing the Healthcare Reparations Cooperative, and we, that's the professional hat I'm wearing. That is also a personal space for me too, because that's a space where we get to dream around how to uncouple those two things from being together. The coupling of health and healing and capitalism exploitation. And I really think too, as we're thinking about this discussion, it's not just health and health systems, and it's also how we have systems within nonprofits as well, and that those are systems of exploitation in terms of our work and our space, and that we are in a context, in a space where even altruism is anti-rest. And that's a terrible place to be, but I'm not going to always be a downer in this conversation, and we will have some joys in it as well. But that's what I got for right now. Peace.
Thank you, Hadija. We're going to continue on to our next panelist, and that is Dr. Nicole Winbush, will offer their comments on this first set of questions.
Thank you. Again, thank you for the opportunity to be here. I guess maybe before I even start talking, I'll just give a little bit of context to who I am and where I am. So I am, I think of all the panelists, not based in the Twin Cities right now. I am in Durham, North Carolina. I did spend about a dozen years living and working in the Twin Cities. And I'll talk a little bit in a moment about my story and my experience as someone who has, well, I'll get to that in a second. So I just want to emphasize what Hadija just shared. What is the problem of rest? And without kind of repeating what Hadija shared, just emphasizing that we are in this very strange time in medicine, but again, across multiple areas of what now I guess are called care economies, right? And so what we see and what the problem in these systems, these care systems, which are really care delivery economies, we've taken something care, which used to be done kind of outside of a formalized economy in homes and communities, and it's become an economic engine. And that's an economic engine that exploits the individuals in the system, whether it's the folks who are, quote, delivering the care or the recipients of care. And you see private equity firms owning these various aspects of the care system, whether it be nursing homes or funeral homes or group homes, and all of this acquisition that's happening, where the bottom line is how much profit can be derived. And even if we are situated in systems that are not for profit, they are still existing within this ecosystem where more and more they are having to compete with these for-profit entities where people are just instruments of that production. So I think it's helpful when we talk about the systems, what's the system that we're talking about? And I think what's at stake is really our humanity, because when we become instrumental in these systems, we risk losing our humanity. So again, what are the systemic and the individual factors? I agree that it's the racial capitalism and it's this exploitive economic system. On the individual level, we're framing this conversation around rest, which I think is really important. And I think the flip side of that is what we see a lot more, not just in healing and healthcare, but across our society, is an epidemic of clinical burnout. And so when people are not able to rest, they often experience burnout. They experience a whole host of physical, emotional, mental challenges. And I also want to elevate how critically important this conversation is. I recently was reading some work by the psychologist. Give me just one second. Their name is escaping me. It'll come to me in a moment. Devin Price, but wrote a piece and held up some research, which is that when we talk about burnout, which can be the end result of people not getting enough rest, that people don't necessarily recover from that. So again, we talked about our humanity being at stake, and it's not a matter of people just getting some rest and then being back to inhabit their full selves. There's a significant proportion of people who never recover from clinical burnout. So a bit about my story. I am a physician. I trained as a family medicine physician and have spent several years working in a variety of care types of clinics. I spent a lot of time working in a community health center in Minneapolis, and I've experienced clinical burnout multiple times. And so now I work independently in an independent practice, a micro practice of my own founding in the Triangle in Durham, North Carolina, where I now offer to the folks that I work with, as well as a way of offering to myself the opportunity to be in a more restful state as I'm practicing medicine and practicing the healing arts. I practice acupuncture and craniosacral therapy and some other approaches. But to get back to just finishing kind of my response to the question, I think there are also individual factors that impact how that play into our ability to rest. And one of the things is that people who are drawn to healing and healthcare professions often have a great deal of empathy and have a great deal of conscientiousness. And it is from that place when that's a matchup then, and I think you spoke to this, Felicia, with a system that really doesn't honor people's ability to rest, that this sort of soup of not being able to care for ourselves can arise. I think the other thing that I just wanted to share is we also, and I'll speak just as a physician, we have the honor and the privilege of working with people at times when the stakes can be very high. And so when we are in under-resourced environments, the idea that we might take a pause or not return that message until the next day, or not fulfill that refill request, it may not be life-threatening, but there are very real stakes. And so when you marry a system that is under-resourced and not honoring kind of what people need to be rested, with folks who are attracted to that work because they are conscientious, because they are empathic, it really is a problematic dynamic. And I think that's part of the problem, are those individual and those systemic factors. Yeah.
Thank you, Dr. Nicole. We'll turn it over next. Prepared comments by Dr. Didi Koka. Next.
Hi, thank you all for being here. I would like to say before I begin that sometimes when we get into some of these topics, and especially experiences, that it can sometimes bring up multiple things in folks, and it's probably make sure that you are taking care of yourself as you are going through this. I think I would agree. I mean, my take, going back to this question on this, I thought it was interesting to start with the problem, problem of rest, that terminology, and also agreed it's the problem is not rest, of course, but what that means to not be able to. I think I would probably prefer not to kind of repeat what some of the others have said. So I'm going to say a few other things that I was going to bring up. One is the idea of, many enter the healthcare profession with this idea of taking care or nurturing, or there's something like that. And oftentimes it's an individual aspiration, and there's not really a good understanding of the individual with respect to the rest of the system. And so, so I really was thinking of taking this question from the idea of that there's the discrepancy, and then building from that. So there's the individual who comes in, and then there's spaces of training that are completely, in the medical field and medical training, even for primary care, which can sometimes be thought to be not as I should say rough, I guess would be the word maybe that comes to mind, as some of the other, that there's this sense that the only way you get your worth or something is by more time and no rest, and I don't know, kind of like a superhero mentality. That is a very, when you're thinking, I mean, I think of myself, as a Black female. It's a very kind of antithesis to kind of most of what, most of the things that I grew up with or would have thought of myself to do. And so it's a very colonial, lack of a better word, white or dominant, I should say, dominant culture, male way of, so I just want to put that out there because that has not been said, this kind of traditional conquer and apply. So it's got multiple levels. So in order to go into that, there's if you're in a conquer or be conquered and you're going in, there's this grappling, I think, of that. That grappling can be against, you fight it, or it can be you join it. And so I think that struggle between like a value systems is one of the areas that I think creates the problem, I would say, of that Dr. Winbush talked about, was the idea of rest and burnout as the ultimate inability to rest. The more that you have these discrepancies, so there's the individual fighting for space and time. There's this idea, like, for example, in my professional life, there's a discrepancy between the individual, seen as an individual, and these kind of set of symptoms and each symptoms get so much time and so much space. And if they don't say the symptom the correct way, you don't get the time, and God forbid you add anything else to it. And so the system has this set of rules, and then you have to come in and adjust. You either fight it, or you fight the person in front of you and you make them adjust, or you kind of chip away at the way that sometimes it's talked about is these micro disappointments, micro sadness. I mean, you're just being chipped away each time as you have to kind of adjust on an individual level of this really large systemic kind of failure to see the whole person. And of course, I'm thinking of this from the traditional one-on-one aspect. So the anti-rest system is commodity, but it's also systemology. The person is defined by their condition, not by themselves. And it's also inability to bring culture, because it is it's sterilized, it's washed, right? So I come in and I can't bring my culture. I have to speak a medical language. All of these things are ways that interfere with the relationality. Relationality interferes with the ability of that person or the practitioner, myself, to engage and have a mutual ability to shore up. I mean, even in what we're doing here, this is a relational. I talk, you talk back, and I get something from what that other person has said, and they receive something. When you take that out of the equation, you're unable to basically heal the wounds of that sterilization process that's taken place of the person you're trying to heal in front of you. So you're unable to basically, in the body, you'd use that by resting, and you repair while you rest. That's what you do in your sleep, you're repairing. And so in this case, you're not getting the natural way that you would repair, which would be relational. You're not allowed. So just a, another aspect or another way. There's a lot more I could say on it, but I think I was given 5 minutes. I think I will, what do we say, pass on, and I can probably bring some of this up in my other questions.
All right. Thank you, Dr. Dede. And next we'll have Dr. Hardeman with their comments to this first set of questions. Thank you.
Thank you. And first, I just want to thank you, Dr. Sai, for convening us and helping to guide us through this important conversation, and also say hello to my co-panelists. I'm really grateful to share space with you all this evening. I have a lot of thoughts about this topic. It is one that is at the forefront of my mind and my reality right now. And so I'm going to do my best not to ramble, because again, lots of thoughts swirling. Hadija, thank you for opening with Tricia Hersey's work. I have sitting on my desk at all times her rest deck, which is affirmation cards that are built upon her incredible writing around rest as a radical form of resistance. So the one I pulled today says, "I will do less, watch me thrive." I don't know if you can see it, but so when I think about defining the problem of rest in an anti-rest system, I think it requires us to first and foremost think about or examine rest as, and this is from my perspective as a public health scholar, it's a fundamental human need. It's a fundamental part of how we are able to thrive or not thrive in our communities and in society. And I think that the inaccessibility to rest is actually incredibly understudied from an academic perspective. I think within community, we are very much aware of the importance of rest, but I think from an academic perspective, and that's the professional role I bring to this space, I think it's an understudied, undervalued, and underdiscussed topic. And that is for a variety of reasons. I think primarily one that Hadija named in her comments, which is racial capitalism. I would also say that, we operate in systems that don't value rest because of white supremacy culture and the idea that labor, that we must treat people as perpetual laborers rather than as human beings that deserve rest and restoration. And also, from a gendered perspective, I think a lot about this issue because women, and particularly Black women or people who identify as women, have been often saddled with the unpaid labor of taking care of the home and doing all of the things that are required to keep a household running, as well as go to work. And I even say in my house, I'm the default parent, right? I'm the one that everyone comes to for their needs. And I still go to work and do all the other things, and so it leaves very little room for literally the act of resting. And I think as we think about the maternal mortality and morbidity crisis as well, we have to be thinking about what does, and the fact that, what our data tells us is that, the root cause of adverse maternal outcomes for Black birthing people in the US is rooted in racism. We can't separate, we can't separate that reality from the fact that we are living in a society that does not value rest in any way, shape, or form for most people. And it's something that, I think we've decided has to be earned, right? So when one decides to take time off for vacation, it's because they've earned days off, right? From building up enough days of working to take that time off. And so I think we've been socialized to frame rest in a very specific way that allows that sort of capitalist system to continue moving forward as it was designed. When I think about my personal and professional experiences with rest, I feel like I have a lot to say, and I'll just say a couple of the things that kind of rise to the top of my mind right now. And as I know, we'll kind of dig deeper into this conversation, but I said this already, that I'm an academic. I have my entire, professional career has been in academia, and I kid you not when I say, from a very young and impressionable age, I was taught in the academy that rest is essentially a dirty word, right? We don't rest. That's not something we do. There's always work to be done, and we should always be doing something. And even to the point where often, it was sort of water cooler talk, right? To talk about like how much work you did over the weekend. I never heard anyone say like, I rested over the weekend, or I hung out with my kid and I slept in and made pancakes. That was never part of the discussion. And so I took that socialization, and also I think even prior to a professional career, I was raised in a community that told me that being productive, being smart, being excellent, particularly as a Black child, a Black girl, and Black woman, was incredibly important and valuable. And when you mix that, and I think, Dr. Sai, you mentioned this in your opening comments, this sort of the myth of sort of Black excellence, when you add that together with people who are driven and also passionate about the work they're doing, it's a sort of recipe for poor health outcomes, I would say, in a lot of different ways. And so it's not surprising for me that it's not surprising now, as I've been doing the work to undo these things and reflect on sort of how I've been socialized, to recognize now that how unhealthy that's been for my own health and well-being. And so, I think we have to be very intentional about shining a light on that, and also and thinking about ways to incorporate rest more actively into our day-to-day. But that also assumes that we are working within organizations, institutions, entities that allow for that. And I think the other part of my personal experience is attempting to fight for that in a system that was never built for rest, at least for me to have rest, right? So part of that was 2 years ago, Dr. Winbush talked about burnout. I'm not a clinician, but even as an academic, I was burned out, and I will never forget saying those words over and over again during my performance review with my supervisor, who just nodded and smiled and moved on to the next question, and proceeded to ask me what my goals were for the following year. And I said to them, I can't even think of any goals, because I am so burned out that I can't think past the next minute. And that went unanswered. It went essentially ignored for a year. And I found myself in my next performance review a year later saying the exact same thing. And it still, went unanswered and ignored. And I think it speaks to the fact that when we are steeped in a system that requires capitalism to keep us moving forward, we refuse to create spaces for to slow down and to rest. And I think that also, again, becomes very racialized in a lot of ways. And the last part of that personal story that I'll share is that I finally decided to take matters into my own hands and say, I need to rest. and requested a sabbatical. And even in that process, and again, I should have started by saying these are my own personal experiences and views and not those that reflect my employer. But what resulted in that request was, well, what would you do on sabbatical? And I said, well, I would like to rest. I even, showed the definition of sabbatical, and leveraged Trisha Hersey's work and wrote a beautiful statement, quoting her around why this was important for me to be a productive member of our community going forward. And was told that sabbaticals were meant for stepping away from the day-to-day to do something else that was productive and would contribute to the institution in which I work for. So me resting and healing was not actually a goal that was seen as contributing to productivity within the institution. And I share that not because I'm trying to wag my finger at, my place of employment, but to say that I think I am certain there are many stories like this across a variety of different institutions and a variety of different disciplines and spaces. And and for me, what it tells me is that we have dug every inch of our, existence into this belief that, that labor and hard work and overworking people and undervaluing care and rest and reflection is actually going to is more important, right? Than anything else. And so I like I said, I'm on this journey right now. I'm a work in progress and really thinking carefully about both what this topic means for me personally, and also what it means in the work and the research I do for Black moms and Black motherhood, generally speaking. So thank you. And I look forward to having a robust discussion as we move along.
Wow, really intense. So just to kind of encapsulate some of the conversation where we are up to this point, is that this problem of rest, and it really is posed, it is not the problem of rest in a anti-rest environment. Rest in of itself is a good thing, at minimally a neutral thing. And you place it with, as has been pointed out, in a capitalistic system where healing is exploitation. Thank you for that, Hadija, that the healing process is intimately linked with a system of exploitation for the laborer, exploitation of the laborer, and even, I would say, exploitation for the people at some level who must exist in the system as recipients of the service. And so it is those two things go together. As Dr. Nicole pointed out, when care that used to be at one point in our history that might have been provided on a familial level, an intimate level, a care level, then becomes commodified. Commodified in such a way that we need to assign a value to it and a dollar amount to it. And in that process, we lose the humanity. That's the other word that comes up. We lose the humanity when people become about dollars. As Dr. Didi pointed out, and this has an eroding effect. This word I love, micro disappointments that lead us to want to fight. And then you become that person, the problem person, the one always got something to say. and that's not good for your career, right? And so it's slowly eroding until we find this place of where we're burned out. And then finally, with all of the wonderful comments of Dr. Hardeman, and it's related, that it becomes a culture. We are socialized in a particular way to sort of take it, that this is part of the process. We are socialized in it. We get a culture of it. And that in such a way where you're standing around the water cooler talking about how you didn't sleep for the last 24 hours is like that's a badge of honor. I'm still going with my cup of coffee and my glass of water because I didn't have time to eat. I mean, it can be that extreme. And so, how do we then begin to address the problem? How do we begin to turn the corner on this? So, what are the next set of questions? What are the potential solutions? How do we find this rest? What individual and systemic sustainable changes can be made to mitigate the burnout and improve our overall health and us as individuals and of the system? What do we do about this, y'all? Clearly, it's a problem. Everyone on the panel has experience with it personally. And now, what do we do about it? Next up,
Thanks, y'all. Yeah, thanks for that really complicated and yet beautiful take on this first question or set of questions. Again, I'm going to bring in somebody who's not here, really modeling in terms of our work with a cooperative. When we think about a solution, we really strive to time travel as a starting point in terms of what are the worlds that don't exist currently, and how can we build into them. And so I'm going to read from Alexis Pauline Gumbs' archive, After the End of the World. This is a speculative fiction work, really intended as a moment of time travel. Those were the ones that decided to steal themselves and donate each other back to the collective. Drastically different in form, substance, and belief from the ones who sold their souls and bodies to the nonprofits. The prophets had been saying the same thing for centuries, but when the point of the Seattle Space Needle punctured the last oil refuge, the vibration shifted enough so that they could hear it. You may not be able to imagine it from here, but back then the very breaths were billable debt, owed back to the ones who wished they never had been born. The bodies of our mothers were land owned by slumlords, burned to the ground so they could get the insurance money that would enable them to wait until the neighborhood was cheap enough for the speculative visionaries to take over with their student loan dreams. Which is to say, no one was free. No part of anywhere was free. Something had to be done. What could they do when everything had a price? If not the stock exchange, then a ledger of the hurting hearts never feeling fully whole. So they stole themselves, which was a break with everything, which was the most illegal act since the law that made them property, and they had to re-rhythm everything, retune bass in their chest, and immediately and perpetually they gave themselves away. The selves they had to give, the reclaimed flesh and bones and skin. So I really wanted to bring this into the space around like what are the potential solutions of the problem and really scope it out. We are thinking about health and healthcare and kind of the framing of this conversation around rest, but it's so universal and it impacts providers, it impacts patients, it impacts us all. And so when we think about the potential solutions to the problem, I also really want to uplift Catherine McKittrick's work around Black geographic and really help us rethink about what is our relationship to space and how we approach this question. So what I've been hearing so far is in terms of the problem is we have this kind of binary of either you get rest or you don't. That inherently is an interesting framing in terms of how we think about it. The other thing in terms of a solution is rest the exposure or is it the outcome? Are we striving for a restful environment or are we concerned about the different quantities or exposure or lack of exposure to rest and how that impacts us as humans? And so I really think in terms of actual tangible solutions, us getting clear around what are we talking about and what is the problem will really help us move forward together in figuring out a way to actually tackle this. I recently presented on behalf of the cooperative at APHA. It's a public health conference. It's huge, it's overwhelming. And I was talking about rest and I had somebody come up to me, this beautiful elder come up to me afterwards. and came up to me and was like, Hadija, you were talking about rest, and I have no idea what you are talking about. And we literally tried to unpack it as the next session is setting up all around us, around like what actually rest means for a health and healing landscape and what that looks like. And as I've been reflecting on that conversation and kind of this impasse that we had around shared language, I really think we weren't able to really figure out a solution is because we didn't know what we were talking about. What were we talking about? A exposure, an outcome, a binary measure, or some sort of continuous measure in terms of how we think of rest. I also really want to say too is we've been talking about this problem of rest, and it's the problem of rest within an anti-rest system. But I really want to offer our inflection as a way to actually start a solution. When we think about problems of rest, we immediately put like, I've been seeing everybody's body go into a deficit, and I've been seeing everybody's voice go into a negative inflection. And what actually would it mean for folks to actually talk about the problem of rest? Rest is a problem, and it is a good problem. We think about trouble, you know, socially we're taught that trouble is bad. But what about if we have good trouble? What about if we have good rest? And what if we actually start to do that little bit of code switching to really think of the problem of rest, not in from a point of deficit, but from a point of action to take what is ours. And that even that little change could be something that could be a potential solution to this said problem. When we think about an anti-rest environment, I think that we are very siloed. This is something, you know, the cooperative is a systems change organizing space. And we are seeing amongst Black-led organizing spaces across the state and across the country that there is a deficit, that they are being forced to operate in a deficit, and there is a lack of rest there too. And I think there's a really important parallel in terms of who are the carers and who are the healers and who are the folks who are going to get us through these tough times. It's those folks who are caring for our bodies, our hearts, and our mind, and the folks who are caring for the bodies and the hearts and the mind of our systems and of our organizing movements. And so I think there's no coincidence that they are both in a deficit right now. And I really encourage us when we think about solutions, how can we remarry those things too? That healthcare operates within a system, and organizing is seen as something on the ground. Where is the intersection there, and how can we all work together to not be in a deficit of rest? And then I'm like looking at my notes. Sorry. Oh, in terms of like finding sustainable changes that can be made to mitigate burnout, I think the first one is being kind with ourselves. I think that because we put rest in a binary of either you do it well or you don't, we pick on ourselves when we haven't done it right, or we haven't achieved something that is some sort of external manifestation of rest. And really allowing ourselves to see it more as a gradation can be a really, really lovely way to mitigate that. In terms of mitigating burnout as well, in terms of the systemic and structural things, you know, I don't work for a hospital system, and I'm gonna say that, like, bless y'all that do, because that is hard work, and it's hard work. But I think in terms of what we try to do in terms of building worlds that don't quite exist yet, is really put that into a cadence of rest. What does it mean to have an organizational structure that is restful by design? And that's something that we have been working on and working towards, really committing to that cadence of rest as a sustainable change to mitigate burnout for us as organizers within the health space. And I really think even inviting your teams into some of that cadence and seeing what could be modeled after could be something as well. I'm going to say it's not easy because as we talked, but yes, inviting y'all to figure out what is a cadence of rest that works for you amidst your overburdened patient loads that are really perpetuating the lack of rest. The other thing too, in terms of mitigating burnout, in terms of the interpersonal and systemic, a personal example is I am currently in the sandwich generation. I have 5-year-old twins. I am getting a PhD. I am leading an organization, and I have an aging mother who is not doing so great, and I am her only caretaker. And let me tell you what, that is not a restful space. But I'm interacting with the healthcare space constantly, if it be for my children or for my mother. It's not for me, that's for sure. But I really think that committing to a cadence uh, and being kind to yourself can be a way to buffer some of that. And knowing that it's not going to be perfect is another tangible solution. So that's what I got.
Awesome. Wonderful. I'm going to turn it over to Dr. Nicole for
Thank
our
you.
next set of comments.
Yeah, so I think that idea of, what are we actually talking about? And, what is when we talk about rest and what is a definition? And I won't try to offer some broad definition. There's a lot of people that talk about that there are different forms of rest. I think a lot of times we default to kind of having a mental or cultural picture around physical rest, which is sleep and naps and meditation, and that's important. But there's many different types of rest. Just as in healthcare, we might talk to patients and clients about different forms of movement and how they're all integral. But I think, and again, I'll speak to my personal experience. The thing that cuts across all of these different types of rest, be it physical rest, mental rest, sensory rest, getting off of devices, for me at least, is a quality of attention that when we are in a rested state, we are able to be present. We are able to be present either with others, if what we're doing is rest that's relational with other people, or we're able to be present to our own embodied experience in the moment. And I think, again, as we talk about these anti-rest systems, and I can speak most cogently to my experience as a healthcare practitioner in large systems, some of what they steal is our ability to rest because they steal our attentional focus, our ability to be present and in relationship with the work that we're doing, with the folks that we are collaborating with on their care, be that through all of the other layers that I think some folks have talked to, not to get too specific, but, all the boxes that need to be checked, right, for the agenda of that visit that has nothing to do with the relational aspect of care, of why that person maybe is here or felt the urgency to make that appointment. And so going back to my personal experience, I have dealt with recurrent professional burnout, and the last episode was so significant that I think maybe to the point of kind of what Dr. Hardeman talked about during the review, I had no ability to sort of make a long-term plan. And I chose with appropriate notice to leave my last employed position without necessarily knowing what the next step was. And so I am in the middle of what has been really an extended professional experiment with trying to create a practice for myself that embodies radical rest. And so the way that and I guess this is sort of talking about sort of just on an individual level, have started to work with this is to really think about my experience of working with people as a physician, as a healer, what allowed me to be truly in presence with them, to actually dream into this world of what it might be like for maybe the first time in my career to have a healing practice, to practice as a healthcare practitioner, and actually have my practice of medicine feel like rest because I'm able to be so present with patients. And so I am trying to feel my way into this practice, and through some of the modalities and the ways that I'm able to offer care, have some of the most satisfying experiences of being in collaboration with care with individuals that I'm working with. But then again, it's within a capitalist system where there's not a great matchup financially for my ability to support myself. So I want to be really clear about that. But And that may not be sustainable, right? I'm in the middle of this experiment, but being able to incorporate sort of more somatic therapies, being able to incorporate some of the aspects of embodied therapies, talking with patients about how they can do that for themselves, and being able to be truly present and embodied in the work that I'm doing as a healthcare practitioner, as a healer, has been really transformational for me. But it has also not yet allowed me to sustainably support myself outside of a larger care system. So that was one thing I wanted to share. And all right, just looking at, I think the other thing, and again, I noticed that I'm giving a lot of sort of individual experience and individual solutions. And again, all of these things need to happen within the context of transforming systems. And I would often bristle when I was working in these larger systems, how, at least at that time, maybe 10 or more years ago, everything was about an individual solution. Oh, we just need to teach these care providers to meditate and, have more relaxation breathing, and, then everything will be fine and people won't be burned out. And that is obviously not true. But I think what I have come to is that there is this importance that we have to have a process of self-inquiry, or at least for me, I've needed to have a process of self-inquiry, because as much as I can, I think with authenticity and empathy, sit with patients and clients and listen to their stories and truly support them on the need to prioritize rest in their day-to-day lives, and to sort of explore what that might look like for them. I had to reckon with the fact that I had a very complicated and conflicted relationship with rest for myself. And so I think that, yes, rest is resistance. Yes, rest is our birthright. But what are the ways in which I don't always practice that, or don't believe that for myself? And I would say actually being self-employed has really brought that up for me, because the work that I do, or the amount of effort that I expend, is in no way a match up for what I'm able to do financially. And so it's very easy for me to often fall into this place of saying, well, you're not making very much money, you need to do more, and to not honor, my own need to rest, and even in this context. But going back to what I was saying, I think there is a place for these self-inquiry processes, for meditation, for in the practice of being able to recognize for ourselves when this inner conflict comes up, when we don't act as if or truly believe that we need or deserve rest. And I mean, I think it's been the subtext of the conversation that we've had, that rest has a racialized history, as people of color, as the descendants of enslaved people, especially. Kind of what rest has often been conflated with has been very problematic. And so I think practices like journaling for me, noticing, have been really important for me to at least raise to that level of awareness where I still have work to do. And from that place, being able to have honest conversations with other people who may be working in systems with me about how we can work together to address that. And, I think I'm almost done here, but systemic sustainable changes, I think it's only from that place of self-inquiry and self-understanding that you can really kind of come together and coalesce around things like organizational change, unionization efforts, what have you, which I think we'll talk about a little bit more in the final question. So.
Great. Thank you. And now next up, we have Dr. Rachel Hardeman. Thank you.
Thank you. I'll be brief, just because I think the previous panelists have covered a lot of, I think, really important points. So I don't have a ton to add. As I think about solutions, sort of on a micro interpersonal level, I do think it's important to recognize how isolating it often is when we're not talking about, the lack of rest, or an anti-rest culture is incredibly isolating. And as a result, I think we don't have the ability to build community or build out our bench, so to speak, in a way that will allow for us to rest, right? So if we aren't collectively doing the work, that whatever that work may look like, right? We just heard about Dr. Winbush, building her practice, right? If she's doing that, if you're doing that in isolation, or without sort of folks who can step in and like grab the baton, right, so that you can rest, it perpetuates this harmful practice of not resting. And that's something I've been trying to sort of think about and unpack in my work and in my personal experiences. And I think some of that is an intentional part of how capitalism is, operates and has built these systems. And also when I think about solutions, I think it has to start with really collectively having conversations like this one so that we can figure out ways to support one another in the active in the intentionality around rest. The other thing, or the other two thoughts I had, one of them is not around well, I guess it is solutions, but it goes back to Hadija's comment around the discussion about what we're actually talking about when we talk about rest. I think it's an important, I have not actually, I hadn't thought about that. And I think it's I appreciate you raising it, because I have thought about it within the context of the phrase self-care. Which I think can often get, sort of equated with rest. And I often am asked, well, what do you do for self-care? And I never know how to answer that question. And I think that because both rest and self-care in particular have become sort of commercialized in a way, we have lost that meaning or haven't really done the work of interrogating what that meaning is. And so I just want to lift up, Hadija, I think your point is spot on, that we have some work to do around really digging into what rest actually means, what that looks like for us. And then the other part I wanted to share is just around the solution, or with respect to sort of the broader, I'm thinking about policy level solutions, which sounds a little bit silly when you talk about like policies that mandate rest. And also, I think we should be thinking and dreaming in that way, right? So when we look at even the United Nations Universal Declaration of Human Rights, there is an article, it doesn't have much in it, but Article 24 does say that everyone has the right to rest and leisure, including reasonable limitation of working hours and periodic holidays with pay. There is nothing else in that statement that expands on like what that actually means and what that looks like. And here in the US, when we think about what that means for us, we are a country that doesn't offer, there's no guarantee that you're going to have maternity leave right after you give birth and start a family. We see so many people who are in positions and jobs who don't get any sort of paid leave and opportunities to step away. And so on a very practical level, I think as we think about and conceptualize what rest is, what it means, and what those solutions look like, I do think I would love to see us turn to policy and think really carefully about what those levers might be to ensure that we are slowly but surely sort of shifting culture across our communities.
All right, thank you. And Dr. Koka will bring us to a close.
So I think I wanted to go back to this idea of relationality. But before I do that, I'm kind of really moved by the stories that I've heard already. And I am steeped in this. I'm a medical director of a medical clinic. It is a medical clinic. There's nothing, how do you say that? Alternative, or, it's in the urban center. It takes care of brown and, multiple different cultures, but particularly brown and Black, individuals, and that community. It's a community I've been, in. It's been 25 plus years in community care, starting in, 3 different types of community clinics in north, south, and east of the Twin Cities before I went into this basically previous public, entity that has become private-ish. And so I'm thinking about that as I'm hearing kind of these stories and kind of grappling with it, and then also seeing this from, this is a long time I've been doing this, and I'm thinking of how this whole idea of, this idea of rest is not even something that would have come up, when I entered my career, and definitely not for someone who's coming out of that community. And so, I want to really kind of honor this history that, this is a community that has not had any representation, there was nobody coming in, we were the new that was representing our communities. And it was a community in crisis. It was complete crisis of healthcare, complete crisis of recognizability, complete crisis of voice, nothing. And so there is a sense, when you're in a war or a crisis, it's hard to rest. I do want to kind of bring that up, that it's a very real, it's very, there can be a basis of this that's honorable. So, but then I think in the last 5 years, maybe 6 years, maybe something like that, this idea of even the community that's in crisis has understood that they are, they're running ragged, and they've redefined these things and allowed healthcare, I think, on the tail ends to be part of this conversation. So as part of these solutions, going back to relationality, I would say having space to hold these multiple realities requires actually, creativity, the creativity of almost like kind of what we often see in literature and these writings, which Hadija has been bringing these voices in, which is wonderful. And so, you need a new space. And I guess the part that I would kind of push against a little bit is I'm not quite sure if the new space is literally a new space or it's a new defining of the space that we have. So I would, and maybe that's because, I'm in the middle of it. I got my own delusion being in the middle. But there's a possibility that that it's a reimagining in the middle of the space that we have. And it's going to probably require all the voices, right? Because if I just do it from the inside, I'm going to be isolated and siloed. And so it's going to require all the community voices. So I'm bringing that up because from what we have tried to do has been, 4.5 years ago, the clinic had an opportunity to start on this, to reimagine and what would it be like. And this idea was to reimagine healing, and could we go back to this central idea of healing? And in healing, in going down this pathway, it's been very interesting to see how spaces, I'm not saying they're going to stay open forever, but how spaces opened up in our day-to-day practice of relationality, of support, this idea that the practitioner needed to be working on their own individual things, and that was supported by other practitioners in that same space doing the same work. And that if you came from that aspect, you would be healing, giving from a spillover effect of empathy, right? And not a cutting effect, meaning that I have to cut off myself in order to give to this other person. And um, I'm trying to, so I'm really trying to kind of explain or show a way of a solution that's in the middle of this rat race, in the middle, And so one of the things, environment. So you come in and there's an environment. How do you make an environment restful, healing, restful? Um, um, I would add these as other similes. I would add healing. I would add relational, like my voice is going to be heard. My needs are going to be met. I'm allowed to have my needs met. And so if it's rest at that time, or if it's a space for that time, can I get that done in the midst of the day to day? And so I'm being very specific for healthcare, and I'm being very specific for traditional healthcare. And so there's an environment, then there's our processes, then there's our leadership, then there's the relational. So then there's relational between colleagues, there's relational between colleagues that are not around me, and there's relational between the person who's coming in. And so it's just a multi-tiered relationality piece. And all of that has to be open. And all of that's when I say open, it has to be open for change, but it has to have some space of openness, because each person comes in each day with different needs and wants and our experiences. And then we build the community together. So this idea of space for building, this idea for space for repairing, this idea for space for voicing, meaning I get to come in and have my voice and it's heard, and then another person, and that's heard in multiple ways. And then this place of safety, where I come in, and how I will come in that day is going to be safely and honored and allowed, celebrated. Yeah. And I just did. So that's a cultural shift, cultural change. And it's, I really do think of this as I think of this as change, as transformational, like water. And I do believe, and some of the folks who've been around me have heard this before, but I do believe this is a penetrate. It just, you have these systems in there, they're like mountainous, but it's water that changes. It's water that can transform a mountain. And you just go and you just wash over, and you penetrate and it just keeps going, and it gets absorbed. And that's actually, I bring that up oftentimes when people get distraught in our transformational change. It's water. Each individual person has no idea what they're doing. They don't know, but all the water changes the mountain to flat land. It becomes a hill. It becomes, I don't know. So that is this other piece that I would just bring in. And, I'm in the middle. I'm in the middle. I think.
Thank you, Dr. Didi. This is fire, y'all. I have thought, just thank you. I really am expressing gratitude in this moment for your ideas. And it's a subtle shift. And I'm going to start just with a brief summary as we hit the last set of conversations. Rest, this is a paradigm shift for me, and it's just a small twist. I am so excited over here, I can almost not contain myself, as rest is the outcome. Rest is the outcome. Thank you, Hadija. It is the outcome of a fair and just system. that requires us to reimagine a future together. That is so powerful. And Dee Dee named it. Dee just gave us the steps. Naming that we have to be heard. It requires a building, a dreaming the future. Dee also said repairing and safety. Because when we get to the next stage where we're talking about what does it take, this is what social workers do now. Social workers are about systems change, but that systems change is hierarchical. And so how do you get the people at the bottom to communicate with the administrators at the top? And Dee named it safety. This requires a safety process where people can feel safe to voice their concerns, to ask for, Dee said, ask for what you need, and to know to allow yourself to have needs, and those needs can be met. So these are just these are simple concepts, and yet they are revolutionary because these simple things do not happen. I'm going to say it again. Rest becomes the outcome of a fair and just system that is built on policy, right? We have policy. We have, thank you, Dr. Hardeman, that the policies provide the structure, the scaffolding, where I no longer talk about self-care, because we talk about self-care like self-care happens because we have a spa day. And so that is not self-care. Self-care is about really a community care where we have the scaffolding in place that allows for what is fair and what is just. So I don't talk about self-care anymore. I talk about community care, and community care means scaffolding, and scaffolding means policy. That we have policies in place that require us to live fair and balanced lives, that we begin to dream the future, that other things that came up in this discussion, we are first kind to ourselves. And for some of us, that will even mean stepping out of the system. For some of us, that means private practice and working from the system outside of the system. I call myself 1 foot in and 1 foot out. And some of us are fully immersed in the system, and some of us are best placed for our own well-being is to completely be out of the system. This requires other words that people said, self-inquiry. Dr. Nicole brought that to us. It requires self-inquiry, self-reflection, to raise our own internal awareness about what our needs are, that we are, and then finally, I want to raise up having systems where we can have someone to pass the baton to, right? That we are not bearing the weight of this all on our own, that there is someone to pass the baton. I am on fire over here as we move to the last set of questions, being also mindful of our time, that we will end just a little bit early. All right, before we turn it in, our last set of questions that we have: what resources are available in the community right now that providers can take care of? How can we network? Here it is. How do we network for change to organize political action on a micro and macro level? So what are we doing? Can we do individually? And how do we mobilize? And how do we work together around? And we've already been given some ideas around that. This is about how do we then expand. I'm going to turn it next over to Hadija.
All right. So yeah, resources and things that folks can take advantage of. So the Healthcare Reparations Cooperative, we exist outside of the healthcare space, and our work is really just to transform the landscape of health and healing using 3 primary strategies. One is healthcare abolition. Say that with me now, healthcare abolition. So, we are an organization that really wants to think through what do the values of abolition mean in the context of health. That means, what does it mean to dismantle, disrupt, and re-envision what exists in terms of health and healing? As I was hearing the earlier conversation about how do we incorporate rest into our practices, I was thinking to myself, I was like, how the Black Panthers do this, because they had free clinics all over the place. And I'm really curious, like, how did they rest? I don't know. Was it just a time where nobody complained and just like held cops accountable? I don't know. But I do think there are models that have existed that we could learn from, that we often forget to turn to in terms of how we can do health and healing in a radical way that really cares for those who are strategically disenfranchised. The work of the co-op, we also really think through what resource redistribution means in terms of how we transform the landscape of health and healing. Within that, we have the Reparations project, which just got seed money from Hennepin County to operationalize what healthcare reparations mean for folks within a place space in terms of economic, systemic, and interpersonal reparations. So that will be starting this next year. We also think through, and somebody mentioned community care. What does healthcare mutual aid mean? How is that a strategy? How do we uplift what others need, not as a charity, but as a, yo, how can we just work together? And as Dr. Didi said, really rebuild and bolster those relationships. And how does that actually change the landscape of health and healing, especially as we are entering a new administration where there's likely to be a lot of reactivity and fear-mongering. Valid fear-mongering, but fear-mongering nonetheless. The other thing too is when we think about the health and healing landscape, research is such a big part of that. And when we think about transforming and what resources are available now, being able to actually research in a different ways that resource community and really allow for communities to form and shape their own narratives is another strategy. And I'm mentioning all this because that's stuff that we're doing that folks can tap into right now. One of the meaning making projects that somebody in community offered that we will be supporting is around healthcare cooperatives. What does it mean to take the existing models of healthcare co-ops and align it with abolitionist values and try it on for size and see what can happen? That's what we're about, piloting new systems that don't exist that really can uncouple racial capitalism from healthcare. Other ways that folks can tap in terms of the resources that we offer, hello Gertrude, is we're about to enter rest and reconciliation starting on solstice. And this is our annual time for us to turn inward and enter into an accountability process, not only for ourselves within our org and our members, but also for folks within the community who we interface with. We will be moving some portions of this external this year to be able to stay abreast of the incoming situation and change landscape. And we will also be incorporating, my goodness, strategy hours into that as well, where that's where folks can actually come and do proactive dreaming to, hey, we're hearing that these things might change in terms of how we do healthcare. How do we get ahead of it? What is the strategy that we're going to have collectively to build together? Last thing I'll offer in terms of resources that are available in the community right now, I already mentioned Healing Histories Project. They do amazing work. But also in spring, we're working towards having a statewide convening of folks who are working to transform the landscape of health and healing in Minnesota. What would it mean for all those folks to come together and say, yo, is there a shared agenda? And if so, what do we do about it? We are potentially going to see our healthcare systems drastically change. And how do we actually use that as a time for world building versus solely being in a reactive space? So those are some things that are happening that folks can take advantage of right now. All of those things are networking opportunities for folks to really organize and for political action, both on macro and micro levels. I will stop.
All right, thank you. And next up, we have Dr. Nicole.
Thanks. I'll be brief and just preface again that I'm not currently in the Twin Cities, so I probably won't be able to offer geographically specific recommendations, but just in terms of general approaches and giving some examples from what's happening here in the Triangle and some things that I'm involved with. I think, again, just echoing what many people have said about the importance of relationships and interconnection and specifically mutual aid. As someone who right now is situated outside of a healthcare organization, it's had its challenges, which I've kind of spoken to, but it's also opened up some other opportunities that I'll talk about that I think are potentially generalizable to folks no matter where you're situated in the care system. But I think in terms of relationships, for me, transgenerational relationships, especially, I think, and again, I may be showing my age and some of my previously examined beliefs, but I think there's a lot in medical culture as someone who just turned 50 and am kind of firmly situated in Generation X. There was a lot of antagonism, and I think, again, this is part of what gets fomented in terms of separating people, in terms of intergenerational divides, for folks who might be entering the healing and healthcare workforce who were younger than us, and a lot of kind of critique often that was happening, using kind of more of a boomer perspective of, folks are not committed, or, they're unrealistic in their expectations, that there should be a work-life balance within, medical culture. And I think it's really clear that folks who are younger are willing, and I think generationally, and I know this is sort of trading in broad strokes, but to think more radically and disruptive about the assumptions that a lot of us, maybe who are older, about how things have been. So here in the Triangle, we have a organizing group of Triangle Healthcare Radicals, and most of those folks are Gen Z and millennials, and are finding really interesting ways to work both within and outside of the systems, to disrupt healthcare and to disrupt some of these assumptions that we've made about how care needs to happen. I think especially as in the wake of a new administration coming, things may get very challenging for folks. And the other piece, I think, is the need to be really relational in terms of transdisciplinary. So as a physician who is in community and in collaboration with a lot of other healers now, and have a lot more latitude to do that maybe than when I worked with informal systems in terms of relationships with acupuncturists and energy healers, being able to collaborate and offer my work outside of an economic model. And again, there's always consent about this. Sometimes we just pay each other, but being able to trade and to barter. And there's just also a very rich practice of mutual aid here in Durham and in North Carolina. So being able to do that with other practitioners, and then to the extent that I can and that other practitioners can, being able to offer my services in various times through various community events, and in a pay what you can model or mutual aid model that would not be possible if I were working within a larger healthcare system, have been really helpful. Just in terms of reinvigorating my sense of the work, and again, that sense of presence that I've spoken to. I might just leave it there. And then I guess just one other thing in terms of transdisciplinary, the importance, not just then of kind of working with other healing practitioners, but bringing other disciplines, the arts, and I can drop into the chat some resources around just ways. I think a lot of times, and again, I'm speaking to my experience, speaking to other people that I know specifically in healthcare and who are physicians, that sometimes we've had to sever or cut off parts of ourselves, the more creative parts of ourselves we felt in service to kind of moving through this career path. And so in my relationship with other artists, visual artists, performing artists, with getting back in touch with some of my own artistic abilities, I think, again, it's not that that's the big transformational work that's going to transform the system, but, being a Buddhist and just believing that sort of these changes that we make on the individual level and with a powerful intent are kind of the ground on which we can come together and have the trusting relationships that allow us to make systemic change. So I'll leave it at that and pass to whoever's next.
All right, Dr. Hardeman.
Thank you. I think I would just briefly add that, I think on a individual level, making, I will speak for myself. I am trying really hard to be, unapologetic about the boundaries that I set. And particularly in spaces where, rest is not part of the culture, it's not discussed, it's not the norm. I think pushing a little bit, in that culture shift direction is important. So, some of the things that that's looked like for me has been even just putting an autoresponder right on my email that says I won't be responding or don't expect a response. I mean, it's kinder than that in the next 2 days. And also including a quote from Trisha Hersey's book, right? Saying like, this is why. And I've actually gotten quite a bit of, response to, and people saying that they appreciate just the explicit statement of that comes along with that. Um, and I think it starts at least, and I'm speaking as someone who's sitting within a large, academic institution where we are certainly not all on the same page about what that looks like. And so I think it helps to start to signal and suggest for folks that like there is a different way here. And so, and it at least starts a conversation. The other thing I wanted to just put out there is the work that Penumbra is doing around racial healing. And they're getting ready to launch their wellness center in 2025 as well. But I think it's a space and an important space and resource as we think about what it looks like to be in community with respect to rest. And so, just wanted to share that as a potential resource for folks.
Next set of questions, wrapping up this next set of questions with Dr. Didi.
I think there are two pieces that just to organize it. There's the organizational or transformational piece, and then there's the individual piece. And I think that's kind of both on macro and micro levels. I think when I think of myself, I feel I haven't been super explicit with myself, except to say that I actually do feel I brought up creativity, and I would actually try to emphasize a little bit more of that there needs to be space and entryway of not just healthcare into this conversation because of rest, because it comes from our communities, and it comes from our system, and it comes from the way that we define ourselves as a country, as a culture. So it requires more than one type of voice and one type of training. And so I do agree with that. For myself, I did a lot of that, mostly just to survive. I actually had some issues in as early as my residency of whether I was going to stay in medicine. And so that was actually very helpful back then because none of this was being talked about. So I actually, I did some career counseling and career exploration in the middle of residency. But that's another story. So that was totally random. And one of the things I did was I, joined a choir, did some art training. And then after I did that, I did an MFA in poetry and writing. So that was, what I'm trying to say is that there was this kind of understanding that I needed this other part of me to be explored. And I remember talking about a little baby that has never had a chance to show itself. And that's that creative part, because I really think that it really is going to require, like everybody, and a lot of creativity, just going to require. And so we really have to honor it in ourselves and then seek for it outside of our, well, I'm in the silo. So outside of our walls, although some of you have already broken away, and then ask for all of those voices to be in the solution when we're talking to our legislatures, because they tend to silo as well. They go back to only, I don't know, the CEO or the healthcare, the health hospital, anyway, exec or whatever. And they silo us too, because they want to only hear this voice, And even when they go into the community, oftentimes they will just silo it and only hear the community, and then don't hear and you're like, okay, great, now you're doing the opposite. Okay. I would say that I actually, when I was looking at this, I was thinking of this from a wholly different point of view. So I'm thinking of like, Center for Spirituality and Institute for Professional Life and Work Balance. I'm like, that's really not enough. I mean, that's not really enough of what we're talking about here. And so I really think that it's gonna require these kind of stages. And I'm very really interested in about this idea of, like, Hadija, I've always talked about cooperatives. So it's really fascinating, this idea of a healthcare cooperative, because I've been talking about that since I was in medical school. And so it's really interesting. There are other ways, there are even other healthcare ways out in our community. I don't know if they're being embraced or thought about from a BIPOC perspective, so that would be kind of the more radical, but there are some other things that are out there that are more than just custodial, or some of these other terms that they use for providing health. I think I'm gonna stop. I feel like, because I feel like there's a lot of other stuff to be said, and it feels like this is more of an ongoing conversation than for us to really set a set of solutions right now.
Absolutely. And so much of it is bringing awareness, is having open community conversations about it, that there's a certain part in the organizing process where just this naming, And so I want to open it up. I want to limit my comments, and people have been sitting and waiting patiently for quite some time. And we are really interested in your comments that you would like to make. Feel free to, raise your hands, unmute yourself, speak out if you have a question or comment as part of ongoing dialogue and discussion that we will have.
So,
What's
Felicia,
going on out there?
sorry, because it's a webinar, they're not able to unmute themselves, but we do have several submissions on the Q&A. And I wonder
okay.
if the panelists want to take a look at those and weigh in.
So there is a comment in the chat that I want to read as we are, sort of gearing up, and people might want to respond or not respond to this comment. I would like to read it out for us, just adjusting a little bit.
Okay, are you also
I'm great.
able? Oh, sorry, Felicia.
To look at the Q&A.
Yep.
There I see the Q&A as well. I'm going to read the comment and then go down through the Q&A. All right. I see it. Here they are. Thank you. All right. Cassandra Stewart says, do you think licensure requirements, ethics that are in place for various healthcare providers impacts folks even coming forward to report they are burned out? For example, if you're a mental health professional in Minnesota and are burned out, you most likely could meet requirements of an impaired provider, hence being subject to licensure sanctions. And of course, that directly impacts one's livelihood. And if you're a single parent of color with no agency, no legacy money, what are your choices? So acknowledging that you need support could potentially bring a sanction. What comments? Anyone would like to respond to that?
Go ahead.
Were you deferring to me, Didi, or no? Well, I was going to say, I don't know that I can say much about mental health specifically, but on the physician side, and maybe more also, Dr. Didi, there's an epidemic physician suicide. And so there's definitely been a lot more attention called to that, different people, some of whom I follow in that space. And there have been concerns about, I guess it's like the medical review board system. And if people do report their symptoms, how that supposedly is anonymous, but it isn't really. And then it can kind of rope them into sort of this, not having potential professional repercussions that they, and I actually don't have all the specifics of it, but there are a lot of potentially negative repercussions, even within what is supposed to be an anonymous system, when physicians at least kind of report that they need help to the medical review board. And maybe you can say more specifically about that, Dr. Dee.
So I'm nodding yes. So what I was going to say is that I feel like I'm hearing a echo, but what I was going to say is that I actually don't know about mental health because, of course, I'm a family physician. But what I would say as a medical director, there's a kind of this space, and this is our structures. There's like a level of deviance, and so within that level of deviance, within our classic medical structure, impairedness or burnt out is okay. Once you get beyond that, then once you get beyond that, there's this idea that you might have to like report to the board. You would have to, and that would be forever. That would never go away. That would be something that's happened to you, and then you would report that every time you credentialed for the rest of your professional life. And so what I was going to respond within that was that this idea of creating a framework for folks to have kind of informal supports within. And so, of course, I keep speaking from, this kind of, I'm in the classic system, but this informal frameworks that are, for lack of a better word, and there is a reason we don't have time for me to explain why this comes to mind, but it's almost like it's like a Underground Railroad type of idea. Like you have these informal networks that support the provider, in their time, when they need the support. And why I think of it is because that railroad is because it doesn't necessarily have to come to a level, if you have it in place, come to a level of higher scrutiny. And I'm not saying you're hiding it, so it's not that. It's what you're doing is you're allowing the person to express a need, which is more support. And then you're bringing the resource of them, and that allows sometimes depends when the person comes. It allows sometimes enough space for that. I don't know, for healing and for continued work. So I don't know. It's not a quick answer, but that's part of this creating, like can we re-envision how this would be? That's part of that re-envisioning piece.
Okay, so this is a really interesting question to me. What does accountability look from an anonymous attendee? What does accountability look like in this conversation? How do we ensure that our rest doesn't end up being escapism? So I actually need to speak to that. And then everybody, you also can speak to that too. And so here, that these are really two separate issues. And it's like, and how are they tied together? That your performance, so if we take something like a rest as resistance, where the claim in that book is that rest is your birthright. Like you just get to, and rest is your birthright. that you get to participate in rest. And so that becomes like an unalienable right. That never goes away. And so when you hear things about like, what about accountability and how does accountability fit into this? That is really about performance. And the two should not be conflated. And even if you are performing poorly, that might be an indication that you need rest. And so there is a subtle connotation in this question that I want to just make sure that we not conflate the two ideas. And so this is about rest, and then another conversation about performance. And if you're having a performance issue, that is a part of this self-reflection. That's a part of the a self-reflection that you engage in with your supervisors, your superiors, the people that you are working with, to talk about this kind of reflection. What is happening here? Because the subtle piece in this is that you are slacking, you're escaping. Well, why is that happening? What's the need to do that? And it also might point back to a systemic problem. So let's not conflate the two. And let's make sure that we understand that we engage in reflection to see what is responsible if there is escapism and poor performance involved. So that's the way I respond to that question. And how do others think about that?
The only thing I'll add is I think based on the last question, this one, we're talking about a little bit of a proactive accountability and a reactive accountability. And that rest can be a way to be proactively accountable to harms you may inflict. We all inflict harm, that's part of life. What you do with them is really what matters. And we are afraid to deal with the harm. And to what Dr. Didi was talking about, I was hearing a lot of themes around like the fear of reactivity and that fear of failure and that fear of asking for help being deemed as a binary rate. And I think that's very related to what you just said, Felicia, around separating the two in terms of performance and performance, like resting related to performance. You can rest to improve your performance. You can also rest as a reaction to poor performance, or you can just maintain an accountability and throughout all of it. I see it very much as kind of a before and after relationship in terms of if we are to put it in a productivity space. But I would also challenge us, like, if we are going to be talking about productivity, how are we then reinforcing a capitalist ideal in terms of put in, put out? And I would really push hard and say rest is not about time. If you didn't follow that, that's okay.
Would anyone else like to respond to that question? All right. And next up, we have from anonymous attendee. In my experience, the term self-care is from the value of individualism and therefore tied to the failure of the individual. If you don't survive within the system, I would love for us to think about collective care where it's on the community to assist us in care regardless of our access to, not based upon our generational wealth or property or properly resourced. I would invite us to imagine what a community would look like if we recentered who is responsible for and with the individual. All right. I just thank you for your comment.
I'll just respond and say it is all about relationality, and there's multiple different tiers and layers to this. You know, there's in and out of the silos, there's patient and provider, there's provider colleague. I said that before, and I think that that's what's talking about. I think the idea of self-care as being an individual issue is as old as my gray hair. I mean, it's just an old idea, and we're on to this new idea. You know, I think though how you do it though may require this holding, we brought up Buddhism sometime earlier, I think but this holding of multiple conflicting things, you can hold all of it at the same time. So you're holding the individual, and I'm holding what I represent and my identities, and then I'm holding my family, and then I'm holding my colleague, and then I'm holding the system. And as each of those areas need their space to rest, heal, repair, each of those areas, right? And not everything's going to happen all at once because I'm human. I can actually only envision so much at the same time. But if you have this intentionality of, we talked about wholeness, then that can work, that can happen. And that's how I respond to it. It's not so much that I shouldn't do the self-care. And because I'm doing the self-care, I'm taking the responsibility of blame. No. It's just that this is just one aspect of all of me in community, as the provider, me as the daughter, me as, if that makes any sense. So all my different relationalities, all of these are in relation with other relationalities, and that's all in the community. And then together, we go together with this idea, and we ask for, and we do, and we create, and we show transformational change.
Thank you. And then next we have a question or a comment and question. I am grateful for the nuggets of wisdom and personal stories that our panelists have offered to the audience. Recognizing that, however, some of us might be speaking from a position of relative privilege, including myself, having the time to attend this webinar. What advice could panelists offer to help individuals who may not be able to make the event tonight, who might be in a lower rung of SES, obtain healing and authentic rest? You're lower on the rung. Like, what about privilege? What do we offer?
Yeah, I think that's a question for us. I think that's a question also for like how these things work. So where is this going to be disseminated to? Who's going to have access? If they have access, do they care? Like, who cares? Like, in terms of like what we're saying, like, I think when we talk about a class analysis around what is put into a privileged space, I'm not saying a true privileged space, meaning like it should be, but like rest is put into a space that it is a privilege. And we've been talking about the fact that that's not how it should be, but I have been in spaces where there have been conversations that feel really inaccessible and feel really actually harmful in terms of my access to basic needs. And so I don't know, would this conversation be something that everyone wants to hear right now, depending on what access they have to basic needs? I don't know that answer. I do think it is a very classed conversation that we are having. And I think that that's just something that we can be very frank about and say that we are having a classed conversation.
There is no rest. I mean, in some sense, I fully get this. There is no rest for the weary. And even, I mean, I 100% agree that it is a very privileged conversation, that some of the privilege, the fact that I have a PhD, privilege that I have the ability to remove myself from the system. Because of my level of education and my level of and the level of access that education has afforded me, I can choose whether or not I want to be in the system. Now, you want to talk about some privilege. That's it right there. And there are many people who do not have the option, do not have those kinds of options, that they're to rest. Because a question mark back to like rest, what are you talking about? There is no rest. If you're a single parent, if you're a Black and brown person, and as a single parent, whether however you identify your gender, that we've talked about people being in the sandwich generation, that all of that means that there is no rest. It is just simply not even. It's not part of the discussion. So how do we begin that becomes an organizing issue? How do we begin to do outreach? How do we begin to educate people that, yes, even for you, rest is your birthright, and you can't do it as a single individual. But then we begin to organize in the collective, and what the collective can do that the individual cannot is very powerful. When I hear things like you have to then pass the baton, that we have to shared responsibility, and then we begin to see that these conversations become more accessible. And that only comes with outreach and education. Yeah, that's how I respond. Any other additional comments?
I would just amplify what you said. I mean, we touched on it a little bit tonight, but it was really more peripheral to the conversation, but just the importance of organizing work in spaces, whether that be workers organizing, unionization efforts, popular education, because I also don't think it's so much that we need to educate people, but we need to be, as has been said, aware of what the conditions of people's lives are, and people who are living in those conditions have, with provided the space, the ability to kind of come up with the solutions that are unique to their positionality. Yeah.
Can I just
Here's the
add
next.
to one thing? Yeah, I was just going to add training and education, because when you think of like some of the other types of things of like what is trauma, what is healing, what are things, these are things that actually have to be defined, and we can use our privilege and our education to define these in terms and use our intersectionality, use our background, use our where we come from to bridge that into a space that can be understood and taught. And so everything has its place, including privilege, and this in this sense, especially this sense of privilege of somebody who's had the time and space to study and learn, and then okay, then you teach, and then you show, and then you translate, you model, and it's not just a hierarchy. I would not, I'm not sure about the wrong piece, because everybody has a piece to bring to this discussion. And so I'm not sure about this lower rung, but I would say that the education piece cannot be said more. But I would just amplify, I would like break that open, that there's potential in there. If that is when you teach them, they understand. You just understand, yeah, that's the piece I wanted to make sure was understood.
All right. We have two more sets of our comments that people would like to make. And here it says, I love the piece Didi spoke to about repair and restorative practices. I feel like this needs to be talked about more, but now even acted on more within community, especially regarding repairing relationships, leadership, community. I feel like there's a lot of individualism in many community spaces, I think that should say, which seems backwards and counterintuitive. Thank you. Thank you for the comment. And then next, I appreciate this expansion, even in language around rest. Is there any language or ways to allow for ease of coordination of care as a patient within the system? I.e., if I'm seeing a PCP, a therapist, a dentist, what are some common terms or language usable that translates well in all systems that document care? And this may be a possible solution as well, but I'd love to hear more about this, or can read about it from any of your brilliant minds later. So if I'm understanding this right, as this is about a care coordination, this person might have multiple providers. And how do we coordinate the care in multiple providers so that people, so efficient systems run, assuming more efficiently, and that there are opportunities for less work and therefore more rest. And do people have ideas about that? I also encourage using systems in places as safely as possible to cover us as we seek rest within systems, FLA, FMLA, etc., as part of our human rights laws. care coordination teams?
I guess I'm not 100% sure that I'm understanding. I don't know if they're still here. The question about whether it's common language around how we talk about rest, or just in general what care coordination looks like amongst different practitioners.
How to ask for that? I think it's a question. I mean, if the person cannot, I'll tell you how I'm reading it. And if the person is still on the call with us, I am wondering if they might be able to clarify. And if they are not, I think it is about what is the language of asking for this need? Like, how do we begin? If you're in need of care coordination, is that like navigating complex systems? If you have a complex health or mental health situation, is that how do you navigate that? What's the language for asking for what you need? Just quickly, as a mental health provider, is that many insurance companies do have a care coordination care. You can request a care coordinator from your insurance provider, and that can often be supplied to you. And that care coordination will allow you to get information about different services that are available to you, to be able to access those providers. And where it seems to fall down from a mental health perspective, that it is about providing access to resources and letting you know what's available for you to access. But once you have those things, the system, as I understand it, doesn't necessarily allow you to coordinate once you already have the service. As a care coordination, as it will help you find services, but not necessarily care coordination from an ongoing standpoint where each one of those providers are working together to coordinate your care. That's how I am hearing it.
Yeah, and the only other thing I would add is there are some programs that come about actually through complete crisis. So, and I'm not sure I would necessarily recommend it, but they, victim of violence, gunshot, and then all of a sudden you can get this long-term kind of care coordination. And I just feel like that it's probably something that is missed. Long standing, somebody who needs it for long standing. We have community health workers that come into and help with some of these things. But even then, they're usually pressed after a certain amount of time, give or take year, less than a year, months sometimes, that they're not allowed to keep that person on. And so that's, again, a structural system thing.
It seems very apt for some of the imagining spaces that Hadija spoke about, because, yeah, I think they went on and clarified, April B., that it was how can we help people advocate for people to have coordinated care around their rest. And I'm not working within the system, but I don't know that something like that currently exists as a possibility within the system, because there isn't an economic imperative for that within the capitalist healthcare system. Yeah.
That's part of how we need to reimagine our future and dream the future, that we have coordination for that. April clarified with better worded, what is the language that can be used in regards to needing rest? That C and A be used and tracked through systems of care, language we can use as a person or to share with those we provide services to. What is how do you ask for, now I'm hearing that as how do you ask for rest if it's not already part of the systems that you're working in? Yeah.
I might offer, so I would be curious if, I'm not sure if April is a provider or coming from this from the patient perspective, but what would it be to have a practice where providers ask their patients what has something that's been restful to you in the last week? I think of our political pedagogy sessions, and we always start with joy. Joy is imperative, and we often question, what's something that's brought you joy? How do we share joy together as a basic need? And so thinking about human needs in terms of like respecting people's identities, pronouns have become something that's pretty standard. asking a person's pronouns, asking a patient's pronouns. What would it be if we just generally asked people what felt restful? What kind of structural and systems change might that evoke in terms of people and how they view themselves as that being something that they are worthy of from the jump, and that is a part of their identity and a part of what makes them whole.
Yeah, that's amazing. It makes me think of, we have health coaching, which is a little bit more integrated into our systems. And so maybe an aspect of that or a next iteration of that is rest coaching, because I think, as we spoke to, a lot of times people don't have a clear somatic or articulation or a knowing of what that is. And so being supported in that process of inquiry and hope, elevating for them that is a possibility, could be really important.
I'm just gonna check in around. Yep. All right, there's lots of appreciation, lots of thanks. That's what I'm seeing here from people in the comments. So we'll pause just briefly. If there is any more questions, any more comments that people would like to make, now is the time to do it. As people might be formulating their last ideas, I want to encourage you that if you would like to be a part of ongoing conversations or networking, if we get to a place where we are can help facilitate additional conversations around creating systems change, would you like any special notifications or updates? Would you be part of a listserv? If you want to be added to a potential listserv or networking opportunities, I would encourage you to drop your name and email into the chat, and that we'll be able to harvest those and be able to share additional future information with you as an ongoing networking and processing. Would you like to know? Would you like to be a part of those discussions? And if you would, drop your name into the chat along with your email address. All right. Rosalba, did you have any closing comments or statements that you would like to make?
I do. First, just thank you so much. I'm very honored to bear witness to this beautiful conversation. It mirrors a lot of what we have been hearing from our sabbatical fellows, which are 10 community members who are with us for 5 months, going through curriculum around exploring the story and the lineage of rest, how folks have had these conversations in the past, savoring their own story of rest. What does rest look like for them in those moments of joy? And also exploring interconnectedness. How do we rest together? How do we rest in ways that allows for, without the depletion of me giving everything? And then our final session is going to be next week with our fellows, where we encourage them to write their dream space statement. What is different because you have carved out this time for rest? What becomes your new practices and routines because you've claimed your rest space? And so this conversation was just very affirming for the journey we've been on with our fellows, and also a lot of great insights. I want to share just 2 things, and then we'll close for the evening because I know folks are tired. One is a small reading from Tricia Hersey's new book, We Will Rest, which is out now. We're super excited to be able to give this to our fellows. She says, how do you find rest in a capitalist, white supremacist, patriarchal, ableist system? The answer, you tap into your trickster energy. You become an escape artist. I am the trickster, the one who got away, the one who always knew, the one able to transmute grief to rest. I'm the trickster, the one who refused, the one leaping from the tops of the mountains into a bed of feather pillows. I'm the trickster assigned as the debt collector by my ancestors, resting to reclaim the dream space stolen. Pay up. I'm the trickster, the one who squinted her eyes, cocked her head, recognized the lies, peeped the scam. And so just a small excerpt from her new book. I'm really enjoying it. Her first book was a lot of the inspiration that helped us build our sabbatical experience for our fellows. One quick share, and then I'll close us out for the evening. I can get my, yep, here we go. So our Heal the Healers work has been doing a lot of stuff. Felicia and her team has been very busy. We held a community listening session back in September. In October, we had our Bearing Witness to the Wounded Healer, where we blended and wove together storing our own journey as healers, as well as somatic practices. We had our Reclaiming Our Own Time in Anti-Rest Systems today. And this is leading to our next Heal the Healers convening, which is an in-person 3-day designed for all healers wherever they may be on their journey. Registration is now open. I'll drop a link in chat if you're interested. And we hope to do more of this work in the coming year because we keep hearing at every gathering, this is very much needed. When are we doing more of these? And how can we hold space together? So very grateful for the folks who were able to be with us tonight. And we will share the recording and transcript with everybody who registered, whether they could be here or not today, and see how we can get it posted on our website too. That's what I have. Thank you so much.
All right. Thank you. Thank you, everyone. Thank you for our esteemed guest panelists, all of our attendees, that your time that you take to do this is really greatly and deeply welcomed and appreciated. Thank you. And good night.
It was good to see you, Dr. Didi.
Yes, it was.
At this point, would love to, if you're okay, I'll maybe have Felicia share. I'd love to hear about your MFA journey or just connect.
Yeah. We need to connect.
Okay.
Offline.
Okay.
Off web.
Yes, exactly. Bye-bye.